This is Radio Health Journal. I'm Reed Pence. This week, assessing the psychological wreckage of the pandemic.
It's very easy to numb out with substances, and it's very easy to isolate because we are asked to isolate. We're choosing to isolate for another safety reason.
The mental health crisis we'll face when the pandemic is over, when Radio Health Journal returns.
For decades, people would say, oh, well, wait till big pharma comes in, wait till big tobacco comes in. Well, you missed the real big, quote-unquote, player, and that's big cannabis.
Understanding the rapidly evolving cannabis industry. Then,
it is the only sorting method that has so far been devised where the person looking things up doesn't need to know anything.
Where would we be without the A to Z method of organizing information? I'm Marty Peterson.
and I'm Gary Price. These stories in depth this week on your public affairs magazine, Viewpoints.
As COVID-19 vaccines are distributed nationwide, millions of Americans are finally allowing themselves to relax a little bit. It seems as if the nightmare we've been living for the past year may finally be over in the foreseeable future. But for many people, it'll take far more than a couple of shots in the arm to recover. America's mental health is in very bad shape.
We have given everyone in our sample screeners for major depression and generalized anxiety, and half of the parents in our sample are screening positive for either depression, anxiety, or both.
That's Dr. Anna Glassman Pines, Associate Professor of Public Policy, Psychology, and Neuroscience at Duke University. She told a recent journalist webinar that some populations are faring worse than others.
This is largely a sample that is people of color. So again, to highlight especially racial disparities in who has been experiencing the largest impact from the pandemic, to just really underscore that people of color who are more likely to have lost access to work, who are feeling greater economic strain from the pandemic, who are also feeling and are more strongly affected by COVID itself, both for their own health, but also people in their families or their social networks. These are, again, accumulating and really leading to a tremendous amount of need for mental health supports and services.
Glassman Pine says it's no wonder so many people are feeling depressed or anxious. Depression and anxiety are natural reactions when anything big changes in our lives. And for almost everyone, lots of things have changed over the last year.
Because the pandemic has heightened health risk, it has also had tremendous economic impact for families. And it has changed so many things about family life that we, in our prior work, have already seen that when families experience an accumulation of stressors related to the pandemic, like an adult in the household having been laid off, like that family having experienced a substantial loss of income as a result, like someone in the family having been ill or having increased caregiving burden, when those accumulate in families, that is really when we see the absolute highest levels of mental health problems for both parents and the young children in those families.
One way to think of it, according to Duke Professor of Psychiatry and Behavioral Sciences Dr. Robin Gurwitch, is like a famous song, which she says has it all wrong.
I absolutely adore Kelly Clarkson. I think she's fantastic, but she got it so very wrong. What doesn't kill you doesn't make you stronger. What we know is that the more stressors, the more traumas, the more difficulties that we have puts us at greater and greater risk for both short-term and long-term challenges. So when we are thinking about families, particularly with children, we're seeing increases in anxiety, depression. Those traumas are cumulative. And so what we will see when children are stressed out, when parents are stressed out, particularly young children, it comes out in behavior problems. And so as behavior problems increase and family stressors increase, the pot is boiling. The pot is boiling, and it is boiling over.
On those days, families are disrupted in a major, stressful way. Glassman Pine says it usually doesn't go well.
Everyone is feeling a lot worse. Parents' mood is worse. Young children's behavior is worse. Parents are feeling more stressed and are more likely to be irritable and lose their temper. So the kind of ongoing daily strains, especially around care and school, have been particularly difficult to handle.
So all of these stressors about everybody in the household is stressed out, whether they're worried about finances or also worrying about school, or an elder parent who perhaps is no longer in a nursing facility but maybe at home. There's a lot of levels at which stress is happening.
Dr. Jennifer Plum Villardaga is a clinical psychologist at the Duke University School of Medicine and a participant in the journalist's webinar.
So there is a coming crisis. It's here. So I think that this cumulative stress will build, not to mention the lingering effects of the grief of all of these missed milestones, students who weren't able to graduate from a level of school or college or high school, family members passing and not being able to have funerals or to honor their passing in the way that we might normally do. So all of these will persist because those anniversaries will come. We'll have missed out on many, many, many important milestones. So it is a crisis and it will persist.
We have tremendous grief happening in this country. That is a unique stressor. Children are experiencing grief in ways that are unprecedented. Families are experiencing grief, and that is another stressor that we add to the mix. And then if that weren't enough, let's just add a few disasters, wildfires out in California, massive ice and snowstorms in the Midwest and in the Northeast. So all of these stressors, it's not just COVID, and then throw in the racial disparities for services. Those cumulative stressors are building and building and building.
School can even be a source of grief for lost routine and lost activities. Gerwich says this may not have been a lost school year, but many children have been enormously stressed getting through it.
It's not just the academics, it's also the social emotional piece that we have in school. It is the nutrition that they get in school. So there are so many more layers to education than simply your ABCs, math and science. For some children, they've actually been able to do fairly well. For other children, virtual learning has been a very much an added stressor. And for some children that were doing great in person and then virtually, they couldn't make the transition and their grades slipped. It has effects on their self-esteem. It affects their view of their own future. So I don't want to say, gosh, this is a lost year, we should write it off, because I think that there are things we can learn from this, but it certainly has put in more challenges.
Some experts say that for some people, it doesn't take the loss of a job or a loved one, or really much of a real threat to themselves at all, to put them over the edge. At least not if they strongly identify with the suffering of others. Dr. Judith Orloff, a Los Angeles psychiatrist and author of The Empath Survival Guide, says she has patients who've developed PTSD in the last year simply by watching the never-ending stream of bad news on TV and social media.
There are some people, and more people than you would think, who are emotional sponges and actually can sponge up the environment around them. My sensitive patients are falling apart. They're anxious, they're depressed, they're stressed out, and there's so much kind of bad news that they have to contend with every day. They have to learn a lot of coping skills in order to stay grounded, set good boundaries, practice self-care.
Self-care depends on how you define it. In the last year, alcohol use has risen sharply. Some would say it's a way to cope when the normal means don't exist. But Plum Villardaga says it may only make an existing substance abuse issue worse.
All of the ways in which we would normally seek to combat a substance use issue and improve our mental health, those are all limited, even though we know that access to professional care is opening back up in safe ways, both in person and virtually. People are still feeling like the alternatives to use are limited, the stressors persist, and it's very difficult to find positive social support because even when we reach out to others, everyone is stressed. So it's really making it a challenge for people to meet their recovery goals. And a lot of parents and adults are really struggling with how to turn their attentions towards healthier behaviors to cope when it's very easy to numb out with substances, and it's very easy to isolate because we are asked to isolate. We're choosing to isolate for another safety reason. So these things all make it more difficult.
Some experts believe that the substance abuse issues brought on by the pandemic will go on for years. Treatment is available, as is mental health treatment, but in too few places, and there are too few resources behind it. So Gerwich says self-care is indeed what many of us need to use first.
I can't stress enough the importance of routine to help reduce stress. And in the pandemic, that has been a very hard thing to develop and to maintain. That doesn't mean at 6 o'clock we have to do this and at 6:30 we do that, but just a routine thinking about what does our day look like? Because routine allows us to feel more in control, to feel that things are more predictable. I know what's coming. So how do families set up routine? Within that routine, there also needs to be time for each family member to have some quiet alone time. That's also very important. I know that's easier said than done, but if it's built in and families can even have a say in what they would want to do during that time, that can be helpful.
Over the last year, one common thought for all of us has been, when will this be over? Now that there's a chance it may happen someday, relatively soon, our experts say that creates yet one more hurdle.
A year ago, everybody was thinking, oh, this isn't going to be such a long-term event, but it certainly has become that. And right now, I think we've got our feet in two different worlds, so to speak. We've got one foot in the pandemic world in which we've been living for the last year, but we've got that other foot in the are we finally seeing light at the end of the tunnel as the vaccine is rolling out? So we are straddling, in some ways, two worlds. Children are definitely trying to figure out where they fit in this world.
And where we fit is wherever gives us hope. We've made it this far. Plum Villardaga says we can finish this off.
I have long been amazed by the resilience of the human spirit, right? And so while there's a lot stacked against us when folks have been exposed to chronic stressors, multiple traumas, both individually and families, cultural, oppression traumas, that there is resilience. And one of the things that I've seen emerging from the pandemic is we're all looking at what actually matters to us. We're letting go of some of the things that perhaps we weren't attending to when we were busy and paying more attention to, if we had the resources, what would we actually spend our time doing? And so, as people are able to feed their families, maybe we can have people return to that natural inclination to say, what is actually most important?
You can find out more about all of our guests on our website, radiohealthjournal.org. I'm Reed Pence. Coming up next week on Radio Health Journal.
If you just sit there, there's a higher likelihood that you're going to be shot and potentially killed.
New thinking on the best way to survive an active shooter.
Then, is COVID-19 the last pandemic we'll ever see? Probably not.
I think we can better understand COVID-19 and perhaps better prepare for future pandemics if we learn some of the lessons of the past.
All that and more on Radio Health Journal.